Thanks again, everyone, for joining us today. I'm thrilled to introduce David Voorhees, the founder of True Captive. As you know, VisionServe has partnered with True Captive to provide a healthcare captive that helps members manage their employee healthcare programs. You can offer high quality insurance while hedging against runaway costs often associated with employee healthcare. David will get started. And then if you have any questions as we're going through the presentation, please put your questions in the Q&A, not the chat, but the Q&A function. And then at the end of David's presentation, we'll handle any questions. And then if there's any questions we can't cover, we'll reach out to you after the presentation. So again, I'd like to introduce David to share more information about the captive.
Like Sue mentioned, my name's David Voorhees. I'm the CEO and founder of True Captive Insurance. Excited to partner with VisionServe, creating the VisionServe Health Alliance. I'm going to try to make insurance really exciting over the next 3 hours and 200 slides. I'm kidding. It's not that long, but I do know that a lot of people don't get geeked up about insurance as much as I do, but I will attempt to make it interesting. And then, of course, please make sure that as you have questions, put them in the chat. We'll either address them during the presentation or afterwards. I spent 20 years in HR and operations working alongside of colleagues like you. So from smaller entrepreneurial businesses to larger global businesses, and they all had one thing in common. There was misalignment in how health insurance worked. And that's where I came up with the concept of building an insurance company that was built from the company up or the group up and not the insurance company down. So a lot of the things that we talk about today should feel like common sense and feel like things that you face every single day when you're either consuming health insurance or managing health insurance for your business. So the concept alongside of my 20 years in HR was my grandfather. He was a retired World War II doctor. He took me on house calls as a young boy. If any of you have seen Doc Hollywood and he would see the whole family, that was my upbringing, except we weren't in the country and there weren't pigs and farmers around us, but it was very much cousins and aunts and uncles would come over and they would also be seen by my grandfather. And so I got to see medicine being practiced in a way that we haven't seen for many, many years. And so as I navigated my career in human resources and operations, many of those things that I saw as a young boy became something that seemed missing and common in building healthcare plans for the businesses that I served. So as you listen to what we talk about today, I hope you hear a lot of those stitches in the context of health insurance and how can we make it more useful? How can we make it more beneficial for your employees? And also, how can we make it financially feasible for you as a business to not only navigate the cost of healthcare, but start to draw the costs down to make it more of something you can profit from versus something that you're waiting anxiously every year to see how much you're going to spend. So I start by telling you that True Captive is the only insurance company in the country that invests its own money, its own capital in each one of its members' programs. So when I talk about what is a captive, you'll hear me talk about some captives you are buying a piece of the insurance company. And if you remember, I was talking about how businesses never seemed aligned with the insurance company. We had a very successful exit from a business, and two of my partners retired. I was too young to retire and decided that I was crazy enough to start an insurance company. By the way, in the middle of a global pandemic, and my wife likes to remind me about that because she said that kind of amps up your delusions. But we started this idea of saying, rather than you have to buy a piece of the insurance company to monetize your insurance, what if we made that investment on your behalf and we partnered together from the beginning? So I'm proud that that's something that we start right from the beginning of the relationship and saying, we're making the investment in you, not you making the investment in us. So let's talk about what is a captive, because then you'll understand why the investment in you is really a defining and a differentiating factor for True Captive. So really a captive is a large umbrella that sits over like-minded employers, and I'd air quote like-minded employers, so people trying to reduce costs and provide better benefits, but to create leverage in the market so you can have greater purchasing power. At a high level, that is what a captive is. And as you might imagine, a lot of people think of scale as being a factor to help you do that, and it's partially true. I'll explain that here in a little bit. But the idea is let's lower costs collectively. So this is a good thing. Um, I know the idea of driving costs down year over year probably seems like it's out of reach. It's not, but you certainly should be driving for that. The second thing is the plan quality. If you've paid attention to health insurance year over year, it seems like it becomes more expensive and it becomes more watered down. So you're getting less for paying more. In most everything that we do in our economy, that's bad. And so what we're trying to do is change that paradigm and try to get more for paying less. You do that through plan quality so people get better benefits, they get better access, they get better customer service, they feel like they're being supported. That's the idea. Reduce volatility. Sometimes you feel like you're on a roller coaster and there's no reason for the ups and downs. So in some cases, you are doing everything you can do to be a good partner inside of an insurance company and you still get a 25% increase despite trying your hardest. Sometimes you have bad years and it's runaway and you have 30 to 50%. The worst I've heard so far this year was a 120% increase, which seems unfathomable. And so I feel the pain for people coming to us and looking for solutions when that's the reality out in the market. So you're trying to reduce that volatility so you can be more consistent. And whether you work in a nonprofit or not, creating continuity in your balance sheet is really important, even more so for a nonprofit. And so that reduced volatility is something that captives aim to offer. And then gaining insights. I talk to people a lot about protective moats. If you are a business of a certain size and you are fully insured, they don't give you access to your data. That is a protective moat around your business for carriers to prevent you from being attractive to the market. Uh, Other businesses look at an investment as a protective moat where you have put in a considerable amount of money into this option, and to get out, it's going to be difficult to get that money out. I think of us as an experience company, and we look at our protective moat as us doing a good job is how we keep you. If we don't follow what we said we were going to do and your employees don't have a good experience, then we would lose a customer, and that's our protective moat. So I consider ourselves an experience company. So really, that's what a captive is at a high level, is a group purchasing organization designed for like-minded companies to try to drive costs down and create better benefits. So who's a captive for? Really, a captive is mainly for anybody that is tired of the inconsistency and the low quality. Listen, I'm not going to vilify fully insured insurance because there's many cases where it's something viable that either you want to participate in or you have to based on your risk. And I think that there are many options out there from a carrier perspective where you have the opportunity to participate in those. But a captive is really people who are tired of not having their data, not having access to high quality, low cost care. So the first thing is what you all should be looking for is seeking savings. That's really important. Now, if that's the only thing that you're looking for, I would tell you a captive is not for you. But oftentimes, if you're on this call, that's not the only thing you're looking for, but you absolutely should be looking for savings. That's really important. Group size. Now, the group size is important, but it's not as important as you might think. Captives are for a wide range of employers, anywhere from, say, 25 employees all the way up to 1,000. But mainly the determining factor is going to be your ability to support a partially self-funded plan. We consider ourselves extended members of your business. And so we want to ensure when you get into a program that you're not putting yourself at financial risk. And so when I say able to support a partially self-funded program, it's simply saying that you understand the financial dynamics and you feel comfortable with them. So the size is not as big of a determining factor as it is of understanding what you're moving into. There is no greater risk really inside of partially self-funded benefits provided that it's organized correctly. And I'll talk about that a little bit later. You want to have control. That's another thing. We aim to build programs that are as easy as fully insured, which really easy. Fully insured programs are very, very easy. They're the set it and forget it option. So we aim to build something with the ease of fully insured, with the dynamics and control of a partially self-funded plan. So you want to be able to see under the hood. You want to see what's driving your costs, what you can do to make your costs go down versus going up. You want to be able to support your employees from a better perspective. That's something really critical. And then the last piece is saying innovative. It's interesting to think about partially self-funding as alternative funding. I partially think they nicknamed it that back then so people would think of fully insured as traditional and self-funded or partially self-funded as non-traditional. But you do want to do something different. And I consider that innovation, especially in benefits, because it's been a laggard in the industry because there hasn't been many changes over the course of the past 20 years. I mean, we've introduced high deductible plans, which have largely failed in terms of how they were intending them to operate. I still think there's some applicability to them, but at the same time, that's been the biggest innovation beyond the exchange, which adds some complexity but adds some options. So people thinking, I want to do something different for me, that's innovation enough in its own. So let's talk about what does it look like for employees. A lot of times when you look at different programs, the idea is what is it going to look like for my employees? What is it going to look like for me as administrator? So when you're switching, we have one criteria that all members have to participate in, and that's your head of HR, your CFO, your CO, whoever is the person in charge of a healthcare plan. We meet every 30 days with our customers for 20 to 30 minutes. The first part of that is we want to hear how things are going. Are there any hiccups? Is there anything occurring that we can get better at? Or are you starting to be stopped in the hallway and people thanking you for the health insurance that you're on? That's one of the funnest things we get to participate in is when someone says, "You won't believe this," but somebody stopped me and said, "I love our benefits." I haven't heard that in how many ever years I've worked here. That's really cool when it happens. So that first few minutes, we want to hear how things are going. If someone's having an obstacle at a doctor's office, or they're having trouble picking up their pharmacy, or somebody's dealing with a chronic condition, and you're open to sharing that information with us, we want to hear about that. We're going to be talking through the data, looking what's occurring. One of the things that really bothered me when I was running benefits inside the businesses that I served was if you were fully insured or you were even self-funded, we would create a plan at the beginning of the year and we'd never touch it until the end of the year. It never made sense to me that if we saw a trend that we could get our hands around, why wouldn't we make a change? Well, if we're seeing trends that are saying we need to make a change or we need to add something or take something away, we have the ability to do so, and we talk about it in those meetings regularly. The last piece is anecdotal, and it's probably one of the parts that make us special, is that when there are things that occur that need support, we're there. I can't tell you how many times that our customer team has been on a call and a head of HR said, "I've just gotten an email. One of our employees just received a cancer diagnosis, or they received a new prescription that they're unclear about," and we're able to mobilize right there and create a solution and action within the next 24 to 48 hours. That's really important because it accomplishes two things. One, it's point of service to your employees. Your employees have better experiences, meaning they can have greater trust in something that they spend the most money they typically do in a year on. What's crazy, and I promise you, if you want to test this, go ahead and do it. But if you ask employees in an open enrollment meeting, just ask, say, "Hey, what are you guys looking for out of your health insurance this year?" It never fails. One person will raise their hand and their answer will be something like this: insurance that doesn't suck. That's really depressing when you think about something that they pay $6,000 to $12,000 a year on, and all they're hoping for is it doesn't suck. And so when something happens, when they need help, if you can prove to them that the insurance plan is there to support them in a way where they don't have to think about it and financially it's not going to put them in a bind, they start to really believe that there's something out there that's going to help them focus on what they need to focus on, which is getting healthy, which is having the access to whatever care they need versus, "Oh my gosh, is my insurance going to cover it, or how much is it going to cost me?" So that's what happens in those anecdotal portions. But 20 to 30 minutes once a month is all we ask for from someone from your staff, HR, finance, executive. The other change from an administrative perspective is the bill structure. So if you're fully insured now, what you get is one bill, and that bill incorporates all the different various pieces to insurance. There's something called a third-party administrator, which they're the ones that are in customer service and send you the card. If you're fully insured, the third-party administrator is embedded in that. How much you pay for pharmacy, how much you pay for claims, how much you pay for the insurance company to protect you, all that's on one bill. When you switch to a partially self-funded plan or true captive, you have two bills. They come from the same place, but one bill is what's considered fixed cost. So it's your stop loss insurance, which stop loss is really exactly what it says it is. It stops loss from occurring. You have what you pay the third party administrator, what you pay us, what you pay your broker. All of those costs are in that fixed cost, and they don't change throughout the year. They only go up or down based on your headcount. The other bill is the bill for the claims. So you don't pay for claims until they occur. So if we're doing a good job helping you manage claims, making them either lower cost or not present at all, right? That money will stay in your bank account. So you'll get a bill when someone fills a prescription. You'll get a bill when someone goes to the doctor, but that's all on that one bill. So instead of one bill for everything, you have two bills. And we work with you to help understand that and to reconcile that along with a third party administrator, but it doesn't really take you that much. The first couple of months, it's a little bit different because you're not used to getting to see all of that. But beyond that, it becomes very, very normal. For what the employees to see is, so oftentimes what we do is we mirror what you're currently doing. So to them, day to day doesn't change. They still have their insurance card. They still have a network that they participate in that they know when they go to the doctor. So they may see a Cigna or an Aetna or Blue Cross or United. They still go to the pharmacy to fill their prescriptions. They can still do mail order. All those things are the same. So the coverage quality at face value is identical to them. Their ID cards identical. The pharmacy identical. Where the differences come are the resources. So a lot of times people aren't familiar with the idea of true healthcare consumerism. And if we build plans right, we don't take anything away from people. We actually give them access to different things. So you can do things like give them $0 copay, $0 out of pocket for primary care visits throughout the year, no matter how many times you go. Not your one-time preventative visit. I'm talking across the entire year. This is a give back to the employees. It costs them no more. So those are resources available to them. Or if they're having a procedure, oftentimes instead of going in the hospital, but going next door to the imaging center that's attached to it, you save 30 to 70% depending on the procedure. The same thing for pharmacy. We can procure medicine from the manufacturer, drop ship to their house at low or no cost, and it's the same drug. We just procured it from a different area. So those are those resources and low prices. And then I think what really shocks a lot of people, especially employees, is you're used to being told what plans you have access to. And you can still have access to those plans if you really, really like them. But I would bet you, if we were honest with each other, you would say that you like them. We build custom plans that are built in the image of your organization so your organization can get the most use out of the plans. And we do that for you. So I will tell you there's a slide up here that talks about work. And I don't want you to think that what I'm talking about creates work. I'm more expressing to you all the things that go behind the curtain so you feel confident in what you're choosing. But at the same time, most of this is taken care of by the team, whether third party administrator or true captive. All right, let's briefly talk about the differences between captive programs. A lot of good captives out there. I'm a huge captive supporter. My only caveat is as long as they're run well, because if you don't run an effective program, it can be harmful to your employer groups that participate with you. Because if you don't manage the money well, it can put your employer groups in trouble and potentially even put the captive out of business. So I built this strategy based on the CEOs that I served in my past, and one of the key themes that they all agreed upon is they didn't like to share risk. You know, hey, we have enough trouble managing our own risk. I don't want to manage somebody else's risk. So in most other captives, what you're doing is you are participating in a pool with other programs, and once you pay your portion, then it goes into the group portion and you're sharing together. And so if they have bad claims, you all suffer. If they have good claims, you all benefit. So that's what a risk sharing captive looks like. Conversely, you also are putting money in, and if the captive runs poorly, you'll be assessed additional costs and fees, which for most people, that's not a fun thing, especially for those that are on a nonprofit fixed budget. So the idea was, why don't we create a risk transfer approach where you still get to participate in that umbrella, where you're working with like-minded individuals to try to create leverage in the market for better purchasing power, lower risk, lower volatility. But at a certain point, then you transfer the risk to us and then we manage it. And because we're very good at managing risk, you're able to participate in something that's going to give back to you. So you benefit in the upside of the program, but because you transfer the risk to us, you don't participate in any of the downside. So if the program runs poorly, that's our responsibility because we own the risk. Unlike another captive where if you own it and the risk is poor, then you're going to pay for it. So we really try to create that example of alignment where if something doesn't perform well, since we're the insurance company, wouldn't you think we would manage it? Versus if you own part of an insurance company, now not only do you run your business, but you're also running an insurance company. So I like to explain the differences between a risk sharing captive and a risk transfer captive. So I talked to you a little bit about managing employees and offering access to care that doesn't exist currently on the market. This was a story that was featured about us in the Business Journal, and it was probably one of the most proudest outcomes that we had early on. But we look at claims daily, and we look at first dollar claims. So we look at the dollar that matters to you. Most stop loss providers, most captives are only looking at things when they get close to the amount that they have to cover. But we look at it from your first dollar because two things. The first dollar drives the experience. That's very important to us. Like I mentioned to you, I feel like we're an experience company. And the second piece is if we're helping you manage your dollar, then it's very rare that the dollar will get to us. So the business can run better. We can offer more value back to our customers. So in this case, we were looking at some data with one of our nurses, and we recognized that there was a younger patient who was dealing with diabetes, a recent diabetes diagnosis. And there were these very large claims and ambulance charges, and we were trying to figure out, like, wait a minute, this is concerning not only because of the cost, but because of the severity. So we did something revolutionary, and I'm being sarcastic. We called the group and said, "Hey, does this ring a bell?" And they said, "Oh yeah, we know who you're talking about. This person has a two-household family, like many households in America, and one household had had the opportunity to do the diabetic education. The other family hadn't done it yet. Well, the problem is when the child had a diabetic episode, everybody, understandably so, would be very panicked and afraid, and they'd call 911, and the ambulance would get them, and they go to the hospital. So it was very scary to the child, scary to the family, very costly. So our solution to us seemed pretty common, but it's very uncommon in the sense that we deployed a private duty nurse to that employer or that employee at no cost. That employee now had access to at the fingertip education, at the fingertip medical, clinical knowledge, expertise to help them manage this. And I'm really proud to say that that resource helped that family get the access to care that they needed. It decreased the angst, it decreased the severity, and much more happiness about having to figure out how do I manage diabetes when it has a negative response versus like how do I live with this? And the byproduct of that was the claims stopped. And so there was a benefit to us by doing something that felt really good because we were providing what we thought is a common sense solution. But we're really proud of that. And there are countless stories like that, and it's really fun to do and look at things differently from an insurance company perspective because at the end of the day, I believe that health insurance is insuring probably the most important commodity anybody has, and it's their health. And I don't think everybody thinks of it that way. I think a lot of times they think of it as, dollars and cents and spreadsheets, and that's a part of it, but that's not what drives it. On the other end of that insurance card is a person, and that person is needing something to help them through something that's probably not very fun. And that's the approach that we take. So to give you another illustration, just so you can see it, like I said, we're going to talk a lot about insurance. I find it super fun, but at the same time, we're spending a lot of time talking about insurance. So we give you illustrations. I like to think about the way that we look at captive, partially self-funding, looks like a house. So the foundation is the part that you participate in. This is your first dollar. This is what you're taking on for your annual budget and you're paying smaller claims as they come in. But when larger claims come in and say, I'm an employee of yours and I need a transplant, well, that's not going to be your responsibility. You're going to pay for your responsibility. And then once it breaches it, It moves to the next part of the house, which is the captive participation. That's that risk transfer. You give it to us. We take on from there. So you're shielded from those large claims. And then lastly is the roof. It protects you from catastrophic. When it's raining, there's hail, there's, very severe cold or heat that's protecting you. So the same thing is we've built the plan so it protects you the same way that your fully insured product protects you today. We don't want you to be exposed to any additional risk. We don't want you as a business to be put in a precarious position because something isn't there. So we built it in a way where there's the self-funded foundation, it's the strength, which is you. It's that middle part, which is us, that's taking a lot of the heavier lifting. And then the last piece is that roof to protect us from anything that might be really catastrophic so nobody's put in a bad position. So I mentioned the slide ahead of time. What you might be hearing is work, work, work. Again, I don't want to scare anybody that thinks that this is going to be more busy work for you or harder to manage. In our case, we work to do that for you, but we do want to be transparent so you understand some of the mechanisms that occur. Maybe some of you think it's fun. I'm always happy to whiteboard with people if they're ever interested in finding out all the X's and O's. I don't often get people to take me up on that, but every now and again I do. So I let people know that. But I don't want you to think it's more work. It's very similar to what you're doing now. So let's go back to talk about that collateral investment and that importance. I mentioned to you about the risk transfer strategy versus the risk share strategy, where the risk strategy is where you make the investment. So in most group captives, you're providing anywhere from 15,000 upwards of 100,000 to buy into the program. When I was pitched that idea now 15, 16 years ago, that was the hill that I died on. In fact, my exact words were, I don't understand why I would pre-front losses that you're inherently designed to protect me from. It was not compatible with my thinking. And so because we participate in that with you, we're making the vast majority, up to 95% of that to you. My original business plan to the Department of Insurance was that I would pay for all of it. But if we paid for all of it, they said we couldn't return dividends to our members. And what's one of the big things with us is our incentives are aligned. We're saying that if you're managing your dollar well and helping manage our dollar well, we want to share our profits with you because our profits are going to be greater if we're seeing success together. But if we're not aligned and you're trying to do something and we're trying to do something, it creates lack of trust and lack of performance. Um, I joke all the time that what we do, I think of as common sense, and it didn't cost us a dollar. We cornered the market in common sense. So again, if we align the incentives, and you're helping us run a better business, then we want to share that with you, opposed to trying to claw and scrape every possible thing that we could because we're not aligned. So you think about this also is confidence-based model. We want people to feel like we're building trust, and it takes a little bit of time. Something was very hard for me when I started this business. I consider myself a trustworthy person. I've worked very hard to partner with a lot of different great people throughout the different companies that I've worked for. And so when someone immediately meets me and go, I don't trust you, that didn't sit well. But I then realized I work at an insurance company, and we've spent the last 30 years trying to take away every piece of trust we have with the public. And so the confidence-based model is that we're there to support you, we're there to help you. So we don't add a lot of blanket requirements, we don't add a lot of unneeded, wasteful requirements that are basically put there to create artificial barriers to people seeking care. We want people to have access to better care at a lower cost. And that last piece that I was talking about when it comes to no surprise cash calls, remember, if you are owning of an insurance company, if you're owning part of that risk, if that risk doesn't perform well, you're on the hook for it. So you're going to have to go back in, and those are called cash calls or collateral calls. But because you've transferred the risk to us, there are no cash calls, there are no risk calls. So that's really important to remember that I think if you're looking at driving costs down and creating better benefits, you also don't want to create another issue by running into something that's going to cost you more. So I talked a little bit about this previously, so I won't spend a great deal of time on this, but I am going to touch on these is we're being proactive and not reactive in how we manage and mitigate risk. The programs that you're in now are unmitigated. Nobody's really actively trying to create a better experience for you, and no one's trying to drive costs down. They hope the costs go down, right? Insurance companies want to make more money than they lose. Unfortunately, most of the insurance companies in the country lose more money than they make. They run at about 102% loss ratio and they live on the float in that 90 days. That's too much danger for me. I'm pretty risk adverse and I also don't want to live in fear. So, from our perspective, that is not any way we want to work. So, we're proactive, not reactive. Those are those 30-day meetings. If right after the 30-day meeting, the next day you get a call from an employee and you need help, you call our customer team and they're going to enable you to have access to those programs, and you'll enable us to be able to get access to the employee to help them when it makes sense. So it's being proactive, not reactive. We're not waiting for the data to tell us what to do at the end of the year. We're looking at the data to help us make action right then to make impact on your staff. The embedded at company level, I think of us as a blurred line in sense of we are an ancillary component of your team. If you need help, we're there. We're not being transactional. We think of it as functional. It's operational. We want to be a partner with you. And so that's really critical for us to think about us as being partners together. If you think about the name of our business, True Captive, the idea is we are a true captive. There's nothing else besides that in what we do. Fun fact quickly, only because I like fun facts. Captive is not a very flattering name. If you Google captive, you're not going to get insurance to come up. You're going to get a lot of things about people being held hostage or captive. I did this once and it scared me. But I also found out where the term captive came from in insurance. It was the name of the first business that ever used this type of insurance financing. So I don't know why we haven't changed the term captive, but at the same time, we said true captive because we wanted people to know that this is what we do. All in support. Our sales team, sometimes you'll see their shoulders go up if they allow me on a call. I tell people this. I said the one thing I can guarantee that will happen this year is something will go wrong. I don't know what it is, but something will. Whether it be someone go to the pharmacy and the pharmacy says you're not covered, or someone goes to the doctor and go, "Oh, sorry, your insurance is expired." Well, that's not the case. It just requires a phone call. Or something even worse. Somebody needs healthcare and where they're going is not network, but there's a very easy solution to that. We lean in. That's the portion of me saying that something will go wrong, but we lean in. We answer the phone. We're there in the good, but we're even more there in the bad because we consider ourselves an extension. We're true partners in this. So that's another part of the team that I'm super proud of is everybody feels that same way, that same accountability to participating in that. And then the success is shared. Oftentimes we get questions about, well, hey, if you're putting up all the money, aren't you taking all of the success? And the answer is no. The reason being is that because we are putting our investment in you, you have to action those items that we talk to you about that are going to help you be better, that are going to help your costs go down. And that's how we will make more money. And so we share in that success because our revenue can be more efficient if we're working better together. So to us, success is shared. It's something that we cannot accomplish on our own. Otherwise, we've been doing this on our own. Responsible underwriting is the differentiator of what we do up front. So when you think about looking at a plan, people underwrite it. Sometimes they do something called shadow pricing, or they're racing to the bottom. You've been purchasing off a spreadsheet. I promise you, you've seen one recently where it has your current insurance plan and the cost, and then you'll see a comparison of one to sometimes there's way too many options like 10. But needless to say, the underwriters at different companies know that you're price shopping. And so they'll either put something really close to get you to think about it. They usually will have one really low priced option and then one option that's a little bit higher. And they know this, and this is how they price things. We preach responsible underwriting. I'm very competitive. I like to win every opportunity that sits in front of us. But I also like to be right. And that means that we need to be responsible with how we approach the risk that we bring on. So, in one sense, we are selective because we are looking for groups that are interested in self-funding and being part of a captive. On the other hand, as long as we underwrite responsibly, we can price any risk. So, we don't chase wins, we underwrite responsibly. What that means is we do diligence on the health risk. very similar to what other health insurance companies do in terms of looking at your loss runs, but we go even deeper to see what is there and what are we good at managing and mitigating, and can we give credit for that because we'll know we'll be able to manage and mitigate it. But we aren't going to take a bunch of risks that we shouldn't. We'll price any risk, but you may not like that price, and that's okay. We know the price is correct, but there may be another insurance company that's willing to give you a different option. And if they do, then sometimes economics are going to drive you to pick that other choice. And we'll tell you, we'll say, look, we don't want you to take this, we don't want to lose, but we understand why you have to because it's $250,000 delta. That's meaningful to any business. So in those cases, we underwrite responsibly in looking at how can we build long-term sustainability. Our program's loss ratio has decreased every year in its existence. It's not by accident, it's by underwriting correctly up front, and it's by working really well with our customer groups to say, what can we do to help you be better? When you have problems, how can we help those problems go away? Or how can we make them not as big of a problem? That's really, really critical. The renewals started the enrollment and the engagement part. Um, our renewals average about 4% year over year, and that's including the ones that, have poor risk that might see something like a 15. That includes people that might have a great year and see a -5. But the average is about 4%. And I think everyone on the call or everyone that I speak to, if I said for the next 5 years you could guarantee no greater than a 4% increase, um, on average, you'd probably jump at the opportunity to sign up for that. And we're very proud that we're able to do that. And again, it's through a variety of those things that I've been talking about of how we approach it. We lead with transparency. So the data is not ours, the data is yours. We prepare it for you every 30 days. If there's something you want to see differently or more, we're happy to do that. If you don't know what you don't know, we'll do a meeting where we talk about here are the things that we look at. Here are some other things you might want to look at because your population is experiencing higher diabetics than more, or your musculoskeletal, so you have more people who are needing access to therapy. You've got more behavioral issues, whatever it may be. Those are things that we can add different data points so we can keep a strong eye on it. The chasing rates without managing risk, that does backfire quite a bit. And again, I come back to the idea of responsibly underwriting because if we're just chasing to win, in good years, you can accident out, meaning by accident, I made it out of the year. But there's going to be adverse years, years that are not going to be successful. And if you're chasing rates without any type of mitigation, eventually it catches up to you and it bites you in the butt. So I do like to talk about that because I think our core strategy from the very beginning demonstrates our practice of responsible underwriting, managing to the right number, being good partners, and winning when we should, and losing when we should. Again, don't like losing, but at the same time, if someone's willing to take on something at a lower cost, sometimes you have to say yes. Now, if you're within 5 to 15, 25,000, those aren't typically meaningful in self-funding because you can make that up pretty quickly in the savings. But if you're talking about 100, $200,000, that's really hard to say no to. You have to raise your eye on why they're doing it, but at the same time, if it's guaranteed, guaranteed. So, one of the things that I hear a lot about, and one of the things you'll hear a lot about if you're looking at self-funding captives, it's this term of no new laser or no rate caps. We don't have enough time for me to talk about why we call these things lasers, but needless to say, a rate cap is exactly what it says. It is something that will prevent you from having a larger increase. There's only so much that you can go through. And there are two main numbers in rate cap world. There's a 35% rate cap and there's a 50% rate cap. To give you context, we've have never in our history had anything remotely close to 35%, and we don't have to charge you for it. But rate caps come with a charge because the insurance company is taking on additional risk. So we don't believe that it's a very good practice to charge somebody something for something that we're already doing. Because when we make an investment in you, if we raise your rate, the investment in you has to increase. So there is a one for one cap on what we do based on how we approach it and how you approach it. So if you have a $500,000 premium and you go to $600,000, well, the original investment is not as enough for a $600,000 premium, so we have to put more money in. So there's something already built in to prevent that. Why would we charge you for it? The lasers are basically taking somebody and saying they have more risk and we're going to charge you more for that person. And that's not always bad, but you have to have a strategy for it. It's also not always good. It's one of those things where I think you have to approach it strategically. And because we're financially aligned, we do that very well because we don't want you to take on more than you need to. We don't want to wash our hands of risk because it's going to eventually catch up to us. But we also want to make sure that you and that individual feels like they're supported and they have the right protections. So our philosophy on those things is why would you pay for something before it's happened? And when something happens, why wouldn't you work to try to create lower cost? Think about this. If your fixed cost goes up in anything, whether it be your rent, whether it be your expenses for IT, whether it be something that you already spent, an event that you put on, if your fixed cost goes up, isn't the first thing that you do is try to drive that cost down, try to look for lower cost alternatives? That's the same thing that we do. And why would we pay in advance for something that hasn't happened? That doesn't make a lot of sense to us. And it goes back to that inline incentives. It creates smarter decision making on both of our parts because we're aligned together to create that. Uh, Another case study that we have a partner PBM. So PBM stands for Pharmacy Benefit Manager. You currently have one if you are fully insured. Effectively, their job is just to work on the pharmacy side. But we had somebody with a very expensive drug called Wellrig. It's between $480,000 a year. We were able to work with the manufacturer to get that at no cost shipped to that employee's home. So the employee saved on the copay, $0 copay. The employer saved on the expense of the drug, which would have been for that company, I think, $120,000. And then they avoided the insurance being used, which could have been penalty at the end of the year. So that was a very large win for the customer. And I think that that's something that, again, we excel at because aligned incentives, and we also want the employee to have better experience. So I have this piece again. I talked about it earlier that we are the only insurance company in the country that directly invests in each one of its members' groups. It's really important to remember because we can win together, and if you lose, we lose together. And guess what? I already told you I'm competitive, and I also want to help people have access and experiences that are high quality. That investment is going to drive the business to do it, even if you think it's a demo and you're going, hey, everybody's great on demos. Well, in this case, we're putting our money where our mouth is, and we're the only people in the country that do it. So I'm going to leave you with one last case study and then open it up to questions. This one is a true story, but part of it I made up, and I'll tell you which part of it I made up because it's just for sensationalism. But there was a member who had a spouse that had been diagnosed to have a spinal fusion therapy. And if you know anything about spinal fusion, it's costly and painful. But this particular instance, it would require or had been prescribed four fused vertebrae. Well, in that case, four fused vertebrae are reserved for combat veterans who have been injured in the field of battle. And this was somebody who'd never served in the armed forces. So that made you think of why are we having four done? Uh, what we ended up doing is finding out that the physician was driving only the level of prescription to the procedure, not the cost of his facility. And I say this because we ended up talking to the physician, and I swear to you, this is the part that I partially made up, is the true story is they were in their car driving, but in my mind, I heard the convertible top shut or the convertible top open and wind blowing through their hair. But in this case, I can't tell you if that was true or not. What I can tell you is we found out it was the facility. And so after a few different calls and talking to other facilities and other partners that we work with, the original facility agreed to do it for a total all-in cost of 45,000 when the original claim that came through was 48 or 480,000. We're really proud that the cost decrease because it's significant for everybody involved. But what we're most proud of is that employee got access to that care at a lower cost, and they also got access to a better procedure that was less invasive once we started to figure out what was occurring. So just an example of the collaboration with everybody on there. So not 3 hours, not 200 slides. We had, I don't know, we'll say 30 slides in 50 minutes or so. So if there are any questions, happy to stick around and answer those. But thank you for listening to me talk about True Captive and our partnership with VisionServe, and we're excited to work with everybody.
Thank you, David. We really appreciate it. And as David said, anybody that wants to, you can just unmute yourself and ask a question if you have any. And David, I'll ask you a question while we're waiting for others. I know that you're offering an assessment, right? Can you talk a little bit about that so that people can contact you and really find out how you can help them without any commitment or any cost?
Absolutely. So what you do now currently is you've probably heard the term you go out to market, and your broker sends your information out to different insurance companies for them to provide you with a quote. So in that instance, we do the same thing in terms of we work with any broker. So we are not brokers. I probably should have said that earlier. We work with your current broker or anyone you ask us to work with. And in that instance, they will send us, or you can send us, your census, your current plan designs, and we can look into the diligence I was sharing with you on what your program would be priced at and what kind of benefits we would recommend. And that doesn't cost you anything. Sometimes it's the straw that breaks the camel's back and you move forward with it. Sometimes it's education that you can look at for your current year and plan for the future. Other times it's ways to tell you like, hey, I'm in a business where I'm in a really good position right now. My plans are working, my strategy's working, but at any rate, it gives you access to learning more about partially self-funding, learning more about captive, and learning about what it would look like for your company.
And then I'm assuming that a member can reach out to you directly, right? They don't have to go through their broker. They can just pick up the phone, call you, and work directly with you for that assessment.
Absolutely. We are friendly to anyone who wants to call us. So directly, if you would like to call us, trust me, we'd be happy to help you walk through what's needed and how to get that information. If you'd like to have your broker reach out, make sure that you let them know that you asked them to reach out. We just want to make sure we understand where the information is coming from so we know how to approach it.
Okay, well, thank you for joining us
No.
today. What we will do is we will send out this recording so that you have the benefit of it and you can continue to go through that. And as I said before, I encourage you, if you have any interest in the captive, to reach out to David so he can connect with you and provide information on how easy it is, right, to kind of switch over to this and then the long-term benefits for your organization specifically.